Could gabapentin, a common nerve pain medication, be quietly increasing your risk of dementia? A newly published study just linked long term gabapentin use to a 40% higher risk of dementia. Even more alarming, younger adults faced more than double the risk. Gabapentin is often prescribed for nerve pain, seizures, anxiety, or chronic pain. It works by changing GABA, an important neurotransmitter that slows down nerve signals in the brain. The idea is that it calms overactive nerve cells. While gabapentin is marketed as safe and non addictive, like many medications that affect the brain, its long term impacts are still not completely understood. This new study, published in Regional Anesthesia and Pain Medicine, analyzed anonymized health records of over 26,000 adults with chronic low back pain who were prescribed gabapentin between 2004 and 2024. The findings are alarming. People who received 6 or more prescriptions of gabapentin had a 29% higher risk of developing dementia and an 85% increased risk of developing mild cognitive impairment just after 6 months of use. Those with 12 or more prescriptions were 40% more likely to develop dementia. Shockingly, in younger adults aged 18 to 64, the risk of developing dementia and mild cognitive impairment more than doubled. And this age group typically isn't even considered at risk for dementia. The study's authors urged close monitoring of patients on gabapentin, especially younger adults, for potential cognitive problems. Now, keep in mind that this is an observational study. That means the researchers have found a link, but not necessarily cause and effect. But the correlations revealed in this study raise big concerns in my mind about the long term safety of this drug. Especially when I'm thinking of the average client I see in my practice, some prominent red flags stand out for me. This study was done on people who were diagnosed with chronic low back pain, and only those patients were included in the study who were using gabapentin for the very first time. But many of my clients have multiple diagnoses: chronic pain, fatigue, autoimmunity, which means multiple systems in their body are impacted: the central nervous system, the autonomic nervous system, immune system, digestive system, even hormones. They are often on multiple medications that change brain and body chemistry. And gabapentin is one of the most commonly prescribed medications. Some of my clients have taken it for more than 10 years. This study showed a 29% increased risk of dementia after just 6 prescriptions, basically 6 months of use. That risk rose to 40% after 12 months. So, what happens if patients continue to use gabapentin after 12 months, say for 3 years or maybe 10 years? Does the risk of dementia continue to rise with the time it's used for? That's my first big question. Secondly, most of my clients are also prescribed benzodiazepines like clonazepam. Benzodiazepines are a class of drug that are central nervous system depressants. This means it slows down brain activity. A benzodiazepine, like clonazepam, slows down nerve signals in the brain by enhancing the effects of GABA. Benzodiazepines on their own have been linked to a higher risk of dementia. So, what happens when gabapentin and benzodiazepines like clonazepam are prescribed together? We simply don't know. I could not find a single study that has looked at the interaction of these two drugs and the effect this interaction has on the risk for developing dementia. But I wonder, if A leads to X and B also leads to X, then can A and B together have a synergistic effect and reach X faster? I don't know, but I wonder how A and B interact with each other and how that impacts the risk of developing X. My third and final question is a practical one. How can my clients tell the difference between brain fog caused by their diagnosis and cognitive decline caused by medications like gabapentin? Really, how would you know? This might just be my experience, but neither my husband nor I have ever had a doctor explain the potential cognitive effects of these powerful drugs. Between the two of us, we have lived in three different countries and seen many different doctors. Not once were we given a baseline cognitive test before starting medications like gabapentin and then retested 6 months later to check how our cognitive abilities were affected by the use of these medications. And I'm not pointing fingers, I'm just asking, as a patient, how are we supposed to know to look out for something we don't even know exists? Most patients don't have access to this kind of research. That's exactly why I'm making these videos. My husband took gabapentin for about 2 years and clonazepam for 20 plus years. We had no idea what these drugs were potentially doing to his brain and nervous system. Would he have taken them if he knew all the risks? Honestly, I don't know. But as a patient, he had a right to informed consent. If you've never heard that term before, informed consent means that before you agree to any medical treatment, test, or even a research study, you have the right to fully understand what's being done and to say yes or no freely. That means you're told exactly what the treatment is, you understand the risks and the benefits, you're made aware of any alternatives, and you're given time to ask questions and decide without any pressure. This matters because you are in charge of your own body. Whether it's taking a medication, having a surgery, or signing up for a study, no one should move forward without your clear, informed consent to do so. I'll get off my soapbox now, but I'd love to hear from you. Does this study raise any red flags for you? Do you feel like you were given adequate information about each prescription drug you use? Maybe your experience with doctors has been very different from mine. I truly hope so. Let me know in the comments below.